very pleased to see such a wonderful response here on the Hill, and also to hear a bit of the panel. And I want to thank you all for being here, and acknowledge Senator Boxer and Senator Coburn for co-sponsoring the briefing. And this is just what we need to get us going on the next steps. So it's important that we hear from our panelists and our experts. And we know that many of you, some of you at least, have traveled very far in order to be with us about such an important topic, and we appreciate that. I also want to recognize Mr. Thomas Lane, who sits on today's panel, and his partner, Deb. Mr. Lane is a hero, at least for me, and because he was one of the first people with HIV to have received a kidney transplant. Now we're going to hear his brave story. It would be hard to be the first in something like that. And I thank you in advance for sharing it with us. And I also wanted to very sincerely thank all of the wonderful organizations that have made this event happen. I was around in the 1980s as a school nurse in my congressional district in my hometown in California. And it was the height of the AIDS scare. And I was part of a task force that the county put together of what are we going to do. Working as a health professional in the schools, there was a lot of worry, there was a lot of fear, there was a huge lack of knowledge, and it was this unknown kind of epidemic at that time. And then, in those days, the medical community was just focused on developing treatments to keep HIV patients alive. I mean, that was like the immediate and foremost task. The furthest things from our minds then, or probably anybody's mind, would have been to offer an HIV patient a transplant, let alone recover the organs from someone who was HIV positive for a donation. No one was thinking in any kind of long-term or any kind of chronic condition situation. In the 1980s, the federal ban on recovering organs from HIV-infected donors kind of made sense. Yet today, it's just a different world, and that's the world that you all know. We've had incredible and unimaginable advances in treating HIV and in organ transplantation, both probably parallel, simultaneous advances. So we can gather now to discuss the repeal of this ban as the next natural step, really, in the treatment of HIV-infected people. Sadly, we're every day, every year, tossing out hundreds of HIV-positive organs which would otherwise be viable for transplantation. Organs that could be going to people who are already HIV positive, organs clearly intended and could save lives, and that's why we need to look at changing the current law. We can start to take the very important steps grounded in medical science, not in fear and wondering, to safely increase the organ supply and make these organs available for HIV-positive individuals. I think that's a very important goal that now I really feel has broad support. Just think about it. We can shorten the waiting list for organs. We can deliver better health outcomes. We can lower healthcare costs. And so we're working across the aisle and across the Capitol to draft a straightforward bill to accomplish these goals. Just the issue of saving lives. That's what we're talking about today. So again, I want to thank Senators Boxer and Coburn for their support, and all of you for being in attendance, and particularly for this illustrious panel, committed to working on a common sense solution for this problem. I look forward to hearing from our panelists and experts who have great important things to say. Thank you for letting me share a few words.